All right, welcome back, and let's welcome our guest. And of course, she is the Secretary of Health, Wellness and Social Protection, Dr. Faith B.Yisrael, and we are here to discuss the new appointment of the board of the TRHA. Good morning and welcome.
Good morning, Brother B. Thank you for having me this morning.
Yeah, we have seen since last year.
No, I think we saw each other early this year.
Okay, all right.
I can't remember.
Okay.
But either way, Happy New Year, just in case.
As well. All right. Let's get straight into it. Of course, former People's Partnership member she was Justice Minister. And of course, Christine Moore, one of my favorite orators, I must say that every time. But anyhow, she's now the chairman of the new TRHA board. Why was she chosen?
Yes, so you know, I think, Brother B, you have asked me a question about the TRHA board every single time I have been here.
Yes.
And we are finally at a point where I can say, yes, we have chosen the board, and yes, we have identified individuals, because I remember you kept asking why, what taking so long, what taking so long? And I really wanted to ensure that we had a group of individuals who were the best at what they do and could work together to ensure that we get the greatest little island as it relates to healthcare. We all know, yes, Ms. Moore has a very long political history. In some instances, we've been on opposing sides of the political sphere. But I saw Ms. Christine Moore as somebody who was steadfast. Somebody who, it's obvious, she's a really good lawyer. So let's just use that as a foundation. She's a really good lawyer. She's solid when it comes, and I have seen that from working with her and interacting with her on that level. But she's also somebody who is very solid and is very sure of herself and what she can bring to the table. And I thought I needed someone who could stand up to me, to be honest.
Right.
You know, who could say, Dr. Faith, that ain't making sense, and this is why it's not making sense, and this is how we can do it in a different way, and this is how we could bring that policy, which is what you are outlining, into reality in a way that works for everybody, in a way that's legal, in a way that takes into consideration all of the things that I may not have thought of. And we can have that conversation with each other, have a difficult conversation with each other, but respect each other and know that, hey, we're doing this together, and yes, we may have differences in how we think about it or how we rationalize what we're doing, but we're doing this together and we're doing this for Tobago. And that is one of the reasons I picked her specifically.
All right, so let's get to the role of the chairman on the TRHA board, and then we'll get to what is the role of the board. So that's two questions. First, the chairman's role. You said you don't mind having a tussle. However, come to the better, bring the ideas. But we need to know her role as chairman.
Right, so let me go back to the overall role and do it hierarchical. The Tobago House of Assembly is responsible via the 5th schedule of the TRHA Act for healthcare, for health on the island. When you look at the nitty-gritty of it, it means we are responsible for policy, meaning what do we want done. The TRHA is not responsible for actually physically doing the things. That is why we have hired the regional health authorities. So the TRHA says, via the Division of Health, Wellness and Social Protection, we want to have 10 health centers run, and we want these services. We want a gynae clinic, we want a this clinic, we want these things. That is the policy. We then employ the Tobago Regional Health Authority to implement that policy and to be the service provider. The board of the Tobago Regional Health Authority is the go-between between the policy, so I say this is the policy, and those who implement, so the CEO and the doctors and nurses and HR and everybody in the TRHA. So the board reports to me, the chairman specifically reports to me, and then the board's responsibility is to then ensure that the TRHA does what we are asking them to do.
All right, let's bring the CEO into perspective, Dr.
The CEO, Mr. Wiltshire.
Mr. Wiltshire, right, let's bring that in. And so let's get to each person having their responsibility following the policy as outlined by yourself. All right, so let's bring, all right, so let's bring outside of the national practice in medicine. Let's say that COVID-19 has a resurgence, this new variant has come up. It is up to you, Madam Secretary, to say, look, we are going to maybe add another wing, and that has to be supported by the chairman and the CEO of as to bring the policy to fruition. In the event that, as you said, there's a resistance, that Christine Moore says, I don't think that's the best idea. You know. This is what needs to be done from her perspective. However, she has gone against your the policy that you outlined. How will that work going forward?
So that is not going to happen. And let me tell you why that is not going to happen. Because there is a different, what we may have is a difference in how we think the policy needs to be implemented. Mm-hmm. The policy comes from the Tobago House of Assembly. As a secretary with responsibility for health, wellness, and social protection, it is my responsibility to say to Tobago, to say to the TRHA, this is the policy direction of the Executive Council led by the Chief Secretary. Mm-hmm. So the Chief Secretary says, this is what we need to do. We need to have these 10 health centers, or we need to have health centers with these clinics. Then that is what we are going to do. Now, we may have a difference in opinion in terms of whether we should have 10 versus 11, mm-hmm. and whether we should put one in Argyle versus Kendall, you know, and we can have that kind of back and forth and that kind of rationalizing about what is the best way to implement it. But the Tobago Regional Health Authority follows the policy of the Tobago House of Assembly, and I am the one who tells them what that policy is.
Mm-hmm. All right, so you have as Deputy Chairman Ms. Jerry. Tell us about her and why that choice was made, and then we get to the rest of it.
Yes, so Ms. Danique Jerry is someone who I met probably under a year ago, because she actually just came back to Trinidad and Tobago, having studied outside of Trinidad and Tobago. She's a public health professional, so she did a master's in health administration. So we actually speak a lot of the same language. She is the vice chair of the TRHA board, but she's also representing on the board an employee from the Tobago House of Assembly. Because if you look at the composition of the board, you have to have a lawyer, you have to have a medical person, you have to have an employee of the TRHA, you have to have, you know, these different, so each person represents those different categories.
Okay.
And she comes with a perspective that is solidly policy. As a matter of fact, within the Division of Health, Wellness, and Social Protection, whenever we need to physically write a policy for anything, that is her job within the division. So I know that she's very solid when it comes to that. But she also comes with a perspective that allows us to think about health care for all. Because while she was in Boston, at the Children's Hospital in Boston, what she was able to do at that point was look at all of the citizens who come in, all of the clients who come in, regardless of their socioeconomic status, and recognize the need for the hospital to take care of all of them, not necessarily those that just have the money and could pay, but figure out how to provide health care for all. And she's going to come with that perspective as well. That
experience as well from Boston. All right,
yes.
We have Alana Allen. Yes, so let's talk about her. Who is she?
Yes, most people know Alana Allen as the vivacious. She used to be the head of the Mount St. George Police Youth Club.
Very good.
I'm sure once you see, you know her. She's a motivational speaker. She's someone who encourages us to know that, hey, we could do this, you know, we can do this. She's one of them who has been saying to young women, hey, you have to take care of your money, you have to evolve, you have to, you know, you have to be responsible. She comes with a very solid financial background.
Excellent.
Very solid financial background. And because of that, she comes with youth, she comes with working with young people, she comes with the financial background, she comes with the understanding that, hey, you know, this is really hard, but we could do it. You know, she is the one who says in the group, let's do this. This is maybe difficult, but let's go ahead and let us do this.
All right, let's go to Dr. Bridget Edmond Benoit.
Yes, so as I said before, one of the requirements for being on the board is you need a medical professional, somebody who has an MD. So Dr. Bridget Edmond Benoit is the medical practitioner on the board. The good thing about her is that she comes with experience of being a doctor. She comes with experience of having worked in the Tobago Regional Health Authority for a little while. She comes with the experience of having worked outside of the Tobago Regional Health Authority because she's doing her own private practice. And one of the things that she said to me when the first time I spoke with her, and we were talking about what is her vision of health, what is her vision of healthcare on the island. And she sounded like if she was inside my head. You know what I mean? She sounded like she understood that quality care happens when the healthcare providers are happy and are comfortable. So she's not just coming from the perspective of the patients, but saying, you know what, we have to take care of our doctors, we have to take care of our nurses, we have to take care of the wardsman, we have to do all of these things to ensure that they are well, and when they are well, we can now provide the wonderful health care to the citizens.
Very good. All right, so let's go now to where are we? Oh, Yvette Parks Carut.
Miss Yvette Parks Carut. Now that is a name that we all know in Tobago, Mrs. Parks Carut. We know her from teaching, but most people don't realize that she also has, she's very, very versed in radiography.
Wow, yes. She's a radio.
Yes. So she's very versed in radiography. She understands what diagnostics are. She understands what it requires to have that diagnostic background. She knows that if we don't know, if we can't get the CT done and the MRI done and the X-ray done, we don't know what is wrong with you. So we can't figure out how to treat you if we don't know what is wrong with you. So she's coming with that background and that understanding. And she's really just a people person. We all know her as a fighter. We all know her as doing what is right for people on the ground. So she's coming with those two perspectives. Her position is really public interest and welfare, but understanding that she really does have a medical background as well.
Nikosi Dick, who is he?
Nikosi Dick. Nikosi, yes. So let me, full disclosure, Nikosi Dick is my Bell Garden boy.
All right. Okay.
Nikosi Dick is actually the son of Miss, am I totally blanking out on Carly Dick and
But what is his background in medicine?
Right. So his background. So Nikosi actually has a business. His position here is as business management, right? But Nikosi actually has a bachelor's degree in environmental science with a focus in environmental health, waste management, emergency preparedness, and so forth. He's currently an employee of TRHA, but he's also a businessman. He does his own, farming and all of these other types of businesses. So he's coming with the business acumen. He's coming with the understanding of big companies, TRHA and so forth. But he also has background waste management, preparedness, emergency preparedness, and those competencies, which makes him probably the best person to be in this position, because he's not just a businessman who knows about farming. He's a businessman who knows that, if we have a mass casualty, these are the components coming from going to school in the United States and so forth. These are the components relating to those things and bringing all of that together.
Excellent. All right, so moving on, we have Mackay Prince Martin.
Mackenzie Prince Martin.
Mackenzie, okay.
Yes, Mackenzie Prince Martin is a young man who I met. He's actually from Glamorgan. A young man who I met a couple years ago. Mackenzie comes to me as one representing young people, but representing young people in a meaningful way, understanding that what he brings to the table is a voice of, we usually, when we usually think of these boards, we usually think of a certain group of people, one set of people, the older ones who been around long time and they done work and they retire and no.
So you did
so
that.
He comes with the perspective of the very young person who may not want to go to the health center or to the hospital because it's not welcoming to young people. But on top of all of that, he actually does have solid financial background. He has been working in the banking sector for a while. He has a legal background as well. So he may be young, but he's been spending quite a bit of time doing his teaching and doing his learning and so forth. He's into project administration and project management and that kind of thing. So he brings the youth aspect to it as well, but he also brings a lot of technical competencies as it relates to business sector, banking sector, as it relates to being in the legal profession, as it relates to being in the research and policy aspect of it. He comes with all of that, but still brings youth and still brings, I must say, he brings the young male perspective, which we usually don't get when it comes to healthcare.
Karen Moore Nicholson.
Well, we all know Mrs. Moore Nicholson. Everybody know Mrs. Moore Nicholson as a retired nurse. She actually worked herself up through the ranks and left the TRHA in, let me make sure I have the correct date, left the TRHA a couple of years ago as a health administrator in the TRHA. So she comes with several pieces of information. The nursing background, yes, but she also comes with a type of institutional memory, because almost everybody else has never actually worked in the TRHA. They probably don't understand the nitty-gritty of what is happening. But because she has been there and she worked there for several years, she can actually say, yes, I remember when we did this 10 years ago. This is why it worked, but this is a pitfall we need to look at, because this is why it didn't work back then. And to bring that kind of experience to it with the institutional memory, because remember, we don't have anybody who was in a previous board before. So I wanted somebody who had the institutional memory of the organization to also be sitting at the table to let us know, yes, this could work here, but we have to take into consideration these critical components because they are part of the organization.
Very good. Right. And lastly but not least, of course, Sajita Simon Wilshire is ex officio member.
So we have two, you just called two different names. Yes, there is Sangeeta Sue.
Yes.
Sangeeta Sue is our industrial relations, our HR guru. Sangeeta Sue, Miss Sangeeta Sue is actually a teacher. She teaches, I met her while she was teaching at Costa, but she also teaches at Bishop's. And coincidentally, I didn't even know this until the first day we had our meeting. She's the one who has actually taught HR to many of the others in the committee. Totally coincidental, because she's just such a solid HR person. So she's the one who we are hoping would bring to the table this understanding of human resource management, this understanding of treating with our clients, our internal clients, what their needs may be and how they need to be represented at the table so that we can get the best service from them.
Very good. And of course, lastly, Simon Wilshire.
Yes, and the CEO, Mr. Simon Wilshire, is the CEO of the Tobago Regional Health Authority. He came on board just about the same time I came on board, maybe a month or so after I became Secretary for Health. It was one of the first decisions that we had to make, actually, because he was interviewed and identified as the best candidate to be the CEO of the TRHA before I became Secretary for Health. And we had to decide, with the whole politics, is them other people that pick him, quote unquote. So we had to look through the process, and I actually said to my colleagues, looking at his CV, looking at the scores for the interview, looking at everything, that this does seem to be a solid person. He comes with a wealth of experience as it relates to management, as it relates to infectious disease, as it relates to so many of the things that we need a CEO to do. So we decided we would definitely allow him to be the CEO. Let's do the assessments, let's follow through. But he's an ex officio member, because as we said, on the board, so he doesn't have like a voting right on the board, but he is the one who is the bridge between the board and then the actual implementation. So the board then says, okay, Mr. Wilshire, this is how we agreed to do the policy. You now go and have your managers and have your whatever do what we've asked you to do.
Dr. Faith, this board has been 1 year late in coming. Obviously, they are going to stay in office or other board for 2 years.
Yes.
Priority number one going forward, that needs to execute as quickly as possible. How soon are you meeting with the board, and what is priority number one going forward?
So the board has actually already met. The board had their induction a week or two ago. Yes, so you should probably realize by now that I like to speak about things when it has happened, after it has happened. The board met, they had a full three-day induction. They've already had their first board meeting last week or a week before, and I started the induction ceremony with them, basically stating that this is an organization that is in a space right now where we can only go up. What are some of the priorities? One, we need to figure out what the structure of the organization is. And you would look at me and think, but it's a big organization. What do you mean what the structure is? We actually do not have a organogram that says these are the positions. This is what is happening on the ground. Well, let me not say that. There is an organogram, but what is happening in the organization does not represent what is on paper. So we have to do two things. We have to look at where we are now, what is working for us, but futuristically, where do we need the organization to be? Do we need to add a particular unit that treats with this thing because we are seeing that it's working somewhere else and we don't have it here? For example, we recognize that quite a number of our clients get lost between being discharged from the hospital and going back into the primary care system. So they are discharged and they have to go to clinic, but the clinic is in the health center. And we are not sure what's happening between those two steps. So we may decide to bring in a liaison unit, for example, that tracks those patients to ensure that, yes, Miss So-so-so, she was discharged. She is actually attending clinic in the Belgan Health Center. She's fine. And if she needs to come back to the hospital, that tracking is also happening. So that's one of the things that's critical. We have to treat with the things that are breaking down right now. For example, I said in palliative last week or week before, our ambulances need ambulances themselves. Full stop. We only have a couple of them that are working, and even those that are working, they go to the garage every week. I kid you not. So what we are doing now as high priority is trying to procure a couple ambulances just so that we have ambulances on the island. So that is something that's critical. The diagnostic tools that are necessary, the CT scan and the MRI and those things. Let's see what we have on the island and let's see what we can get on the island to ensure that it works. Ensuring that we beef up primary care. So we actually have more stuff happening in the health centers to ensure that you are well or to prevent you from getting to the hospital. That is also a critical component that I've asked them to look at right now. And there are a couple other things.
Okay.
Starting with, though, I think probably at the top of the list is understanding that healthcare quality is something that we can always improve. So we are doing all of these other things to ensure that we have good quality healthcare on the island.
All right, I want to go to, I'll deal with Roxborough separately, but I want to just do generally. There is need for expertise in varying areas. You said that you sent out there, apply if you wish, because we lack people in varying areas of expertise. For example, if you have to do a heart surgery, then we need to fly out, and this fly out concept, bone specialists and so on. There was the argument that if we have to bring these specialists, how many bone break in a week or a month, and sometimes a year, you go sit down there and get paid and nothing happening. Dr. Fit, is there an approach to bringing experts in the varying field, in the medicine field, to carry out their duties, as to house them, and instead of have to fly out people from Tobago?
So the argument that you are talking about is one that we've had from the beginning. Yes, if we have a cardiologist's pay is big money, but how many cardiac surgeries, how many heart surgeries do we really need done here? And one of the things we have to think about on the island is what are we selling? And we cannot just think of Tobago or think of the services that we provide in Tobago for the 60,000 of us who are resident on the island. We have to start thinking about providing services to Trinidad and to the wider Caribbean. So we need to look at which of these services makes the most sense to provide here. So for example, we have one of the best hyperbaric chambers in the region. And I'm not even telling you about in Trinidad and Tobago, I'm talking about in the region.
Wow.
We have people coming from other countries to use our hyperbaric chamber. So it may be worth spending money to improve on that specific service, because it is something that is already attracting people. It's something that people could come in from all over the
And
world.
will it earn as well?
And it can earn money. As a matter of fact,
can earn or will earn?
has earned.
Okay. And will continue to
and
earn.
will continue to earn.
Yes.
So, so that is how we have to look at each case, each specialty, because it may not be worth, for example, having a cardiologist in Tobago when there are 10 in Trinidad right there, but it may be worth having another specialty in Tobago that we don't have in Trinidad, so we can bring up the clientele.
Excellent.
So it is having that kind of strategic conversation, looking at the data, looking at what we can do and what we can do well here, and not just jumping and saying, let us do all of these things. Because let me tell you what has happened to us. The reason we have so many health centers on the island, for example, Tobago has one of the largest population of health centers for the number of people that we have here.
Right.
If
So
you
go,
then necessary, if you go to any district in New York or in Boston or whatever, for the size of the population, they may have 1 or 2 hospital, they may have one little, for the 60,000 of us here. And that is because in the past we've actually had people like me, politicians, who you would go to a meeting, a public meeting, and somebody say, I want a health center in my village, and the politician says, yes, we'll give you a health center, and you now realize that there are 5 health centers within a 5-minute drive from each other, when that is not necessarily the best use of our resources.
Let's bring those into perspective and tie Roxbury in, because time is of the essence. Outfitting these the health centers and the hospital in Roxborough, there was an issue of equipment that were needed. Are they outfitted completely? And can these health centers extend their hours? We know nurses go home at 4 o'clock in some cases. Just speak to that. The outfit of the equipment that need to be outfitted in the hospital in Roxborough and the health centers throughout the Tobago.
Right. So the health facility in Roxborough actually is fully equipped at this point. We have practically all of the licensing, because the issue was not necessarily the equipment. The equipment was there, but whether we had the licensing from the pharmacy board and from this and from that. So that part is taken care of. We are really now just waiting on the HR part of it. So let me again see. What is happening right now at Roxborough is that we have the health center facilities that is being housed in the Roxborough Health Facility. So that is where you say, the nurses are there from 8 to 4 and they do their normal health center functioning. But there's also an accident and emergency setup at the Roxborough Health Facility that is there Monday to Friday, 7 to 7. So 7 a.m. to 7 p.m., not on weekends. And what we are waiting for right now is the HR, meaning the specialists, the senior doctors and so forth, so that we can have the inpatient services. The inpatient services would then allow us to have 24-hour accident and emergency, and if you need to sleep in the hospital, then you can sleep in Roxborough and don't have to come to town. And that is going to be the next step. I am not giving a timeline, because I have learned that these things never work in the same speed I want them to work. If it was up to me, we would have done this conversation since last year this time.
Right.
I can't give a timeline as to when that will happen just yet, but know that when it is announced, it's because it has actually happened.
You did say the last time that the hospital was not fully operational.
And that is what I mean in terms of there are no inpatient services. So if you are outpatient, meaning you have a gynae clinic, you can come into Roxborough, do the gynae clinic, and go back home. If you need to dialysis, because there are dialysis machines there, you can go get your dialysis and go back home. If there's a service that requires you to sleep in, so you are now an inpatient, that is the part that is not ready.
Are they equipped with beds? Are they outfitted with
the beds are there, the equipment is there. All we need right now is the staff to do
How many beds do we have in Roxborough?
23, I think, is the number of
There's
beds.
also, before you go, must ask you about the dispensary and pharmacists.
So all of those things are in place, because if you go now to Roxborough and you get a prescription from the health center, even from the accident and emergency, you go right there, there's a little window that says pharmacy, and you get that right there. I have actually been a patient at Roxborough, where I went in and I got all of my scans, all of the ultrasounds, and you got the results right there.
Right away?
Some of them you could get right away. Some of them you may have to wait a couple hours. Some may need to come to the lab in Scarborough. So it depends on what exactly you need. But the service, I was actually able to walk out with papers that say...
Well, look, I'm going to Roxborough for my scan, you know, because tell me about the one here in Scarborough. Obviously, there has been some challenges, and of course, Ms. Karut, who is a radiologist,
yes,
would be able to bring us up to speed in the event. There's a media conference, and each person can speak on their department, which I'm totally happy with. And so it was worth the wait, should we say. In closing, ma'am, what would you have to say to the public, given this new installment of new board of the TRHA?
So I am actually very, very happy that we took the time to get the individuals who I think are the most competent individuals to do this. Tobago, I am asking you to work with me and to work with them to ensure that we really, really get healthcare on the island up to the point where Tobago really is the greatest little island. That is our mantra. That is what we're heading to. This needs to be the greatest little island on the planet, and healthcare would be part of making this the greatest little island on the planet. But we need you to work with us. Again, thanks to all of the members of the Tobago Regional Health Authority for all of the hard work that you all have been putting in all of these years. You all have not had a break. A lot of us got to stay home. They didn't get to stay home. They had to be there in the middle of all of COVID and continue to function. Thank you so much. And this, what we are doing now, is really to bring all of this together to ensure that you and Tobago has the best service.
Excellent.
Thank you.
Doc, thank you. And of course, our new board. Doc, let me say good morning to Ms. Christine Moore, my good friend. Congratulations to all of you. Ms. Caruth, these are individuals I know, so I want to wish them all the best, and I know we'll do well as a people once we have the right people in place and highly qualified, all of them, and congratulations. So let's go now for a break. When we come back, Nigel and Marvin moving to the left. They after 20, how many years they're together?
Oh my goodness.
And here they have a song, and I tell you, when you hear this song, Dr. Phil,
I know the song, man.
The new one?
I know the new song.
Oh my God, it's powerful. So see you after the break. Thank you again.
No problem.